Okay, and to our main program, we will have Lacey Stone, our member, introduce our main program. Just a couple of quick facts about Lacey. So Lacey works for St. Jude Children's Hospital after nearly a decade with UNICEF USA under the current CEO, Caryl Stern. Just one interesting fact about Lacey. She's working her way through a 26 outdoor activities challenge this year where she's hiking, kayaking, and snowshoeing her way around the Pacific Northwest. She looks great, so, come on up, Lacey.
Thank you so much. I am so incredibly thrilled and delighted to be able to introduce our speaker for today. While some of you may know me as the Senior Development Director for St. Jude Children's Research Hospital here in Seattle, I also carry the distinct privilege of having worked under our next speaker's leadership for nearly 10 years while I was at UNICEF USA. Many of you in the room may be intimately familiar with Rotary's partnership with UNICEF as part of the Global Polio Eradication Initiative, and we are actually fortunate today to have several UNICEF USA staff members with us, including Eric and Megan, who are based here in Seattle, so welcome. And you may know that from the launch of the GPEI, or Global Polio Eradication Initiative, in 1988, nearly 18 million people, mainly in the developing world, who would otherwise have been paralyzed are walking today because they have been immunized against polio. So I want to thank UNICEF USA for not only being here with us today, but also for your amazing 30 years of partnership together. Now, what you may not know is that UNICEF works in more than 190 countries and territories and has helped save more children's lives than any other humanitarian organization in the world. And they do this not only by providing health care and immunizations that you're familiar with, but also safe water and sanitation, nutrition, education, emergency relief, and so much more. Caryl Stern has served as president and CEO of UNICEF USA since 2007, working to put children first. Caryl is also an activist, an author, an executive, and a public speaker who has dedicated her career to helping others. So without further ado, it is my honor to introduce you to an amazing leader who continues to inspire me through her compassion and through her wisdom every single day. Please join me in welcoming Caryl Stern, UNICEF USA President and CEO, to the podium.
It's really nice when they're not on your payroll anymore and they say nice things about you. Good afternoon. It's really a pleasure to be here this afternoon, and I want to offer some very sincere appreciation to your President, Cindy Runger, Vice President of Programs, Rob Labasco, Sergeant-at-Arms Ken Grant, who, boy, I need someone like Ken on my staff, Steve Crane, Mariah Kimpton, and really the entire team at Rotary here in Seattle. I so value our partnership with Rotary, and it is a privilege to be in your city. And I think the people I've named, as well as many of you in the room, are true examples of what service leadership is really all about, and that Rotary exemplifies across the country. For those of you who were at the Rotary International Convention in Toronto last year, my kids refer to that as my Bruce Springsteen moment. I got to stand on the stage in front of 25,000 Rotarians, scared out of my mind looking at this huge auditorium. But it really was one of the highlights of my career, and not only because of the sheer number of people I got to speak to, but because I truly was surrounded by a room full of amazing, amazing individuals who care so deeply and passionate about the world that we all live in. So it is a privilege to be here today. Before I talk about UNICEF's contribution to eradicate polio, I think it might be helpful if I just ground the conversation in a little bit about what UNICEF is. After 30 years in the civil rights movement, I got a call and was asked to come to UNICEF. And this is what I knew, if I can get Michael to change the slide. This is what I knew predominantly about UNICEF, was this little orange box. How many of you have ever trick-or-treated for UNICEF? How many of you had kids who did? Thank you. 1 in 10 Americans has actually trick-or-treated for UNICEF. We were founded in 1946, and we were supposed to be a temporary agency created primarily to help children in the aftermath of World War II. We were going to make Europe safe again for children, and then we were supposed to go out of business. But somewhere along the lines, it was recognized that we really needed to go beyond that initial agenda, and that we had to be the organization that does whatever it takes to save and protect the world's most vulnerable children. And that is our mission, to not only ensure that children survive, but that they thrive. So you might ask, why UNICEF? What makes UNICEF unique from other organizations who also do really great work on behalf of kids? And the simple answer is that UNICEF works for more children, in more places, on more issues than any other humanitarian organization in the world. Basically, UNICEF does whatever it takes. That's our motto, do whatever it takes. We're not daunted by war, we're not daunted by geography. When roads are impassable, we just take a boat. When boats are not possible, we find another means. If we have to, we walk, we use donkeys, bicycles. You'll see later on exactly what I mean by that. But we find a way to reach the most marginalized kids, the most vulnerable kids on the planet, and we try to help solve problems not only top down, but more importantly, bottom up. UNICEF is in it for the long haul. We don't just build a well and walk away. We build a well and we make sure the community knows how to maintain it. We make sure the government is going to support that it does get maintained. We don't just build a school, we make sure there's a trained teacher in the school, and we make sure that school fees are eradicated. We make every dollar go further. We buy and we distribute more life-saving goods for kids than any other organization in the world. We have amazing buying power, which enables us to really leverage every dollar we take in. And we think big. UNICEF doesn't just vaccinate one village or one country. We are the largest provider of vaccines in the world today. And we help stop disease in their tracks, and you help us do that. And I think the thing that attracted me most to UNICEF when I first got asked to come is that UNICEF innovates. We are not your father's Oldsmobile. We are an organization that is nimble, even though we are large. So as you can see, if we can get the map up there, as you can see on the map, UNICEF is active in 190 countries and territories, and that means that we translate all of that commitment into action, focusing on kids all over the globe. And we focus on the hardest to reach kids. We really believe that those are the kids most in need, and we're going to get there and we're going to help them. We provide vaccines to reach 45% of the world's children, 45%. So let me talk for a few minutes about UNICEF's efforts to eradicate polio. Within the global polio eradication, I have a really hard time with that word, which makes me a little ineffective on this topic, but eradication initiative, UNICEF is leading in vaccine supply and social mobilization, which means we're reaching millions of kids with polio vaccines multiple times every year in more than 70 countries. And we work with partners in government, we work with NGOs, other UN agencies, the private sector, to provide the immunization to the kids who need it most. So let me dig a little deeper into what social mobilization really means. Community acceptance, community demand are the bedrock of a successful polio eradication goal. We can't do it if the community's not willing to be part of it. And so it boils down to the interaction between the vaccinator and the parent on the doorstep. And if we can't get those two to unite, it doesn't matter what we bring to the village. I have seen far too many supplies sit in a corner because either the community doesn't believe in them or the right person isn't just bringing forth the facts. So communication is key. And social mobilization is that process kind of engaging a wide range of both traditional community, civil society members, opinion leaders, but also maybe some of the non-traditional, talking to the children directly, getting the children to talk to their parents. And through alliance building and partnerships are often combined with media campaigns, social mobilization engages and motivates action. And it motivates various partners at national and local levels to raise awareness and to demand for a particular development and to provide sustainable, multifaceted solutions to big, broad problems. UNICEF polio communication teams in countries, they organize these mobilizers to go out and to promote vaccination campaigns. Our first priority, build trust with local communities so that health workers are welcomed. We've all read about health workers who have been attacked. We've read about them being shunned. Our first and primary number one is let's get them welcomed in the community. We address the fears of the community, we address the misfacts in the community, and we get their support and their trust before we roll out the campaign. Health workers, often women, they make the most difficult journeys to the affected areas. They work with local leaders, and they literally go house to house to ensure that every child gets the vaccines they need to stay safe. And despite circumstances like community resistance, remote populations, general restrictions on public activities, curfews, warfare, etc., these healthcare workers are fighting to make polio history. They have true perseverance. They have true commitment. And these women are just educating their communities, and they're vaccinating kids, ensuring that no child is paralyzed due to this crippling disease that we can indeed eradicate. So although there's no cure for polio, the virus can be prevented and it can be eliminated through immunization. And by vaccinating every child, and I do mean every child, and ensuring that no child is missed, they are creating what we reference as group immunity, and that's a critical step to eradication. So female healthcare workers play this critical role in getting buy-in from the community leaders. They engage with the religious and the traditional leaders, the polio survivors, the ambassadors, and all of the social networks that may exist within a particular village. And the network of social mobilizers continues to grow, with women, again, at the forefront of most of the networks. And in the last few years, there has been marked progress in increasing the number of women in those healthcare workers. So, for example, in Pakistan, women currently make up more than 56% of the frontline healthcare workers and account for 90% of the vaccinators in the country's highest risk areas, which is an interesting fact for a country whose rights for women vary from ours. In Afghanistan, where insecurity and strict gender roles often restrict women's work and movement outside the house even, women now make up 27% of the social mobilizers, was 9% in 2016, so that was a pretty big jump in that year, and 40% of frontline workers. And in Nigeria, over 90% of frontline healthcare workers are women. These are big changes in these countries. And UNICEF, for example, currently supports more than 1,500 female healthcare workers in Afghanistan alone. And we believe that every child should have access to vaccines, regardless of where they live, regardless of what they believe, regardless of whether their parents are present. We believe and we're committed to finding ways to reach every last child. So 3 years ago, for example, national immunization campaigns in Pakistan reached 75% of all children in the country. In 2017, we reached 95% of all the children in that country. So let me tell you a little bit about how that takes place, what vaccine delivery is really about. Our supply division, UNICEF's supply division, is headquartered in Copenhagen. And there are 1.5 billion doses of the oral polio vaccine that we administer each year, 1.5 billion doses. So the logistics of that are huge. So the supply division will forecast how many they think we need, what are the demands of particular regions. They'll coordinate with a local office, what can you actually deliver. They'll coordinate with many of your colleagues on the assistance in that delivery. And we will do our ordering, we'll procure the OPV, we'll also secure price reductions. Our buying power allows us to truly negotiate significant reductions in cost. And then we will basically depend on the guaranteed production of vaccines, multi-year allocations for vaccine financing, and long-term forecasting. And then with strategic hubs, which we've placed in Dubai, Panama, Shanghai, as well as Copenhagen, we will then disperse the vaccines around the globe. So let me give you an actual example. So the vaccine is flown directly from the manufacturing plant, and it arrives by plane in Islamabad. This is just one of our routes. So on arrival, the vaccine shipments, first thing that happens is they get inspected, usually by the Ministry of Health, and they basically ensure that the vials are intact, nothing is broken, and that the quantities are correct. There's a big counting that takes place. But they also have to make sure that the temperature monitoring devices report that the proper temperature, there's a cold chain with vaccines, and we have to make sure that they actually have been kept at the temperature they were supposed to for the entire trip. Okay, so they arrive in Islamabad, and the first thing that happens is they're put in a vaccine store in Islamabad, and from there they're dispatched throughout Pakistan. There are more than 1,000 kilometers from the village that they may be reaching to that particular store. So the central vaccine store typically have walk-in giant, think of giant refrigerators, and they're just filled with vaccines. So health officials then transport the vaccine in an insulated box. It's called a cold box, and again, it's to keep the cold chain going. And the journey continues initially by Jeep. So vaccine, worker, cold box in the Jeep. They go through the back roads of the northern Sindh province, let's say. When the health worker gets to hilly terrain, they no longer can use a Jeep. So then the vaccine and the worker get out of the Jeep and they get onto the backs of donkeys. And they take donkeys, which is already their third method. We've gone from plane to Jeep, now we're on donkeys. So the donkeys go up the mountain, and the polio team members begin this, negotiation of holding on to a cold box on the back of a donkey. After traveling again, plane, Jeep, donkey, they arrive in the remote village. So in this case, it's Chandakot, there we go, which is in northern Sindh. So the last steps are taken on the fourth means of transportation, which is on foot, because once we get there, there is no road. And this is a healthcare worker administering drops. That's what happens next. Now we've gone from the factory into the mouth of a child, and the journey is complete. So after we vaccinate this child against polio, the team member puts an identification mark, a little ink mark, on the little finger of the left hand. And that allows future workers to know which kids have been vaccinated and which kids have not. No ink mark, no vaccine. But of course, the fight is not over. We have more work to do to accomplish our goal. The challenges remain, but I think we are seeing that we can and we do overcome the challenges as they arise. So while the world has made this incredible, incredible progress, there are these challenges. Conflict, war breaks out, we can't get through. Insecurity, massive mobile populations, operational barriers, the Jeep breaks down, the donkey dies, you'd be amazed at what goes on. And in some instances, just a parent's refusal to allow us to vaccinate their child. And we are committed to overcoming these challenges because we must vaccinate every child if we're going to make a difference. So we're thankful to Rotary in particular. We're thankful to the CDC. We're extremely thankful to the World Health Organization, the Bill and Melinda Gates Foundation, and to governments around the world who are joining together to create a polio-free world. But there is one other issue I'm really up in arms about, I guess, and I want to raise before I walk off. And that is the millions and millions of children all over the globe today who are on the move. There are over 50 million kids on the move today. 28 million of them have been forcibly removed from their homes. That's 1 in every 80 children are living in forced displacement right now. And I've had the privilege to travel and to meet with these kids. I've been in Bangladesh, I've been with the Rohingya children, I've been in Jordan with the Syrian refugee children, I've just come back from the Central African Republic, meeting with kids there. And I've met with these people in Kenya, in Sudan, and even at our own border here and in Mexico. I met a woman in Bangladesh that I think exemplifies what this journey is really like for someone. I just randomly picked somebody in the village to talk to. I asked her, how did you end up here? She was holding a child. She had another one by her feet, and literally picked her out in a child-friendly space, and she told me her story. And she said they had been out on a picnic. They came back to the village that they called home and found that it had been burned. One of her children actually died in the fire. She grabbed her remaining children and they took off for the woods, she and her husband, and they hid for 3 weeks. And as she put it, some days we ate, some days we didn't. And after 3 weeks, when they realized going home was never going to be an option, they began to walk to Bangladesh. She had given birth only a week before this, so she was carrying a newborn child as they walked. And to this point, she told me the story without cracking an emotion, very stoically. And then she said, on the 6th day of the walk, the baby died. And as she told me this, and her voice really broke, and she said, and the hardest part for me is I had to bury my child on the side of a road that I don't know where is, and I will never find my way back to. Even if they let me back in the country, I will never find where I buried my child. And when I talked to these people and I said, how do I help? What do you want? Everyone in the Rohingya camp said, we want justice. Promise us when you speak, you will tell people, we are people. We are alive, and we need your help. So I share that with you because they are people. And the numbers are so big, and it's so hard for me to stand here and get you to fathom the numbers. But she is just one of the millions of stories that I could tell you. You know, I want to comment for 1 second on future possibilities. We have been partners, UNICEF and Rotary, for a very long time, and really good partners. I think that we have worked well together. I hope and I trust that as we move towards new challenges, that we can do those together as well. So I will wrap up with my final story, because I've just been told. I was in Bangladesh, and for those of you who were at the Rotary International Convention, I believe I told this story there, but I want to tell it again because I think it's important. There was a child who stayed with me all day, and at the end of the day of work, we realized this child had not eaten all day. Little 3-year-old boy who walked behind me all day. And at one point, we had been given these little biscuits. They were nutritionally enhanced biscuits. Myself and the actress Taya Leone was with me, and we both, she more successfully than I, are trying not to eat carbs. So we had palmed our biscuits. And we realized this child hadn't eaten, and with him was his sister who was carrying a baby, and they had been walking with us all day. And so we gave this little boy that you see on the screen a biscuit. And we thought he'd just run off and gobble it up because he hadn't eaten all day. I kind of looked at it, and he looked at me, and he looked at the biscuit. And then with no one saying anything at all, he broke that biscuit in half, and he handed half to the baby. And I share that with you because if a 3-year-old who has nothing is willing to share the little bit of something that is sustenance, that his life depends on, just imagine what all of us could do. Imagine what you have in your own little backpack that you could share. Thank you for sharing it with UNICEF. Thank you.